Welcome to today's Explainer. We're putting on our medical detective hats to decode the hidden clues, the biomechanics, and the absolute vital interventions surrounding neonatal soft tissue birth traumas. For a newborn, entering the world is this massive, complex biomechanical event. Usually, they handle this physical stress perfectly well. But sometimes, when the mechanical forces just push past the tissue's limits, a completely normal delivery crosses the line into pathological trauma. Today, we're going to track that exact journey step by step. Here's our clinical roadmap for today. We'll cover birth traumas and causes, caput sixtatenaeum, cephalohematoma, muscle and skin injuries, and finally, prevention and treatment. Let's dive right in.
Section 1. Birth traumas and causes.
So, what exactly pushes a normal delivery into the danger zone? Well, the main culprits really fall into three distinct buckets. First up, maternal conditions. If there's a size mismatch between the mother's pelvis and the baby's head, or if labor is just crazy fast or excessively long, the baby's tissues are put under severe compression. Then we have fetal factors. A baby weighing over 4,000 grams, which is known as macrosomia, faces way more friction. On the flip side, premature babies have incredibly fragile blood vessels that can rupture under normal pressure. And finally, we have medical or iatrogenic factors. While tools like forceps or vacuum extractors are sometimes absolutely crucial to save a life, they do apply direct, intense mechanical force to the baby. All of those risk factors trigger a surprisingly simple but pretty brutal biomechanical chain reaction. We're really just talking about three basic physical forces here. The newborn's tissues either get squeezed through compression, which literally starves the tissues of blood flow, or they get forcefully pulled through traction, which tears muscles and vessels. Or third, they're subjected to the negative pressure of a vacuum, which actually pulls blood right out of the vessels, creating hematomas.
Section 2. Caput succedaneum. Is it safe?
All right, let's look at our very first suspect in the delivery room, caput succedaneum. Now, this one looks scary to parents, but it's really just a superficial pooling of fluid, mainly blood serum and lymph, sitting just under the skin but above the bone. Think of it like a tourniquet effect. When the baby's head enters the mother's pelvis, the pressure builds up, venous blood struggles to flow back, and fluid just sort of seeps into the soft tissue, creating this localized swelling. As a medical detective, what are your clues here? How do you know for sure it's just a caput? First off, it's right there the exact moment the baby is born. Give it a gentle touch and it feels kind of soft and doughy. But here is the absolute golden rule. Because this fluid is just hanging out right under the skin, it readily crosses the skull's suture lines and fontanelles. It totally ignores the borders of the underlying skull bones. And the best part? It naturally resolves on its own in just 24 to 72 hours. No surgery, no panic, just basic hygiene. Section 3, cephalohematoma, a much more serious issue. Now, we have to contrast that harmless fluid with a much more dangerous condition called cephalohematoma. Unlike a caput, this is an active, slow hemorrhage. It's real bleeding. The intense pulling forces during labor actually cause the membrane covering the skull bone, the periosteum, to slide and rip the tiny veins underneath it. So blood starts accumulating tightly beneath this outer membrane. It's totally trapped, and the pressure is slowly building. This is your ultimate diagnostic showdown. Caput is just fluid. Cephalohematoma is blood. Caput is there on minute 1. Cephalohematoma drips so slowly that you might not even spot it for 12 to 72 hours after birth. But the absolute biggest giveaway, because the membrane is pinned down tightly at the edges of the skull plates, a cephalohematoma is trapped within the borders of a single bone. It literally cannot cross the suture lines. That one anatomical quirk tells the physician exactly what they're dealing with. So why the big fuss over this? Well, a cephalohematoma is a lot more than just a cosmetic bump. As that trapped pool of blood breaks down, it dumps massive amounts of bilirubin into the baby's system, triggering dangerous jaundice. If the bleed is large enough, the baby is actually losing significant blood into their own scalp, causing severe anemia. Plus, if someone improperly tries to drain it too early, it turns into a highly dangerous abscess. And if left entirely untreated, that leftover blood can literally calcify into solid bone, leaving the child with a permanent skull deformity. Section 4, muscle and skin injuries. Now, the trickiest thing about these next injuries is how incredibly deceptive they are. They are masters of hiding in plain sight. On day 0 in the delivery room, the baby looks completely fine. But fast forward a week or two, suddenly a torn neck muscle shows up as a visible lump. Fast forward a few more weeks, strange, hard nodules of dead fat begin popping up under the skin. These are the delayed echoes of the trauma that happened weeks ago during birth. Let's dive into that neck muscle trauma, which leads to a condition called torticollis, or wry-neck. Imagine a really difficult birth, maybe a breech delivery, where the large muscle on the side of the baby's neck gets severely overstretched and tears. It bleeds internally. As that hematoma heals, it forms tough scar tissue. And scar tissue doesn't stretch, so the muscle literally shortens, pulling the baby's head down toward the injured side while twisting the chin up and away. If this isn't caught quickly and treated with postural therapy or massage, the child can develop permanent facial asymmetry. Next up is a really fascinating one involving the skin and fat layers, called adiponecrosis. These are hard, painless little lumps of fat on the cheeks, shoulders, or buttocks. They happen when the baby experiences low oxygen or severe cold during birth, causing the fat tissue to literally crystallize and die. The golden rule here? No way, absolutely never massage or squeeze these lumps. But the real hidden danger is wild. The immune cells trying to clean up this dead fat go completely haywire and overproduce vitamin D. This forces the baby's body to absorb way too much calcium, leading to hypercalcemia, which can fatally wreck the kidneys. So the crucial move here is to immediately stop all vitamin D supplements and monitor their blood calcium weekly. Finally, Section 5, Prevention and Treatment. At the end of the day, prevention is an absolute tag team effort. It's a medical relay race. It starts well before birth with the obstetrician closely navigating the pregnancy. They use ultrasounds to spot unusually large babies, rely on continuous monitors to catch oxygen drops, and strictly limit the use of vacuums and forceps. But the exact second that baby arrives, the baton is passed straight to the neonatologist. Their job is the immediate, careful palpation of the baby's skull and neck to find those hidden injuries. Crucially, they immediately administer 1 milligram of vitamin K to enhance blood clotting, effectively stopping any hidden hemorrhages, like a cephalohematoma, right in their tracks. To wrap up this explainer, I want to leave you with this vital question. Whose hands hold the power to prevent disability? As we've just seen, it's never just one person. It requires the hyper-coordinated, deeply knowledgeable efforts of the entire medical team, catching these hidden clues way before they become permanent scars. So the next time you look at a newborn, just think about the incredible, hidden, biomechanical journey they just survived. Thanks for joining me on this investigation.